does a person's omega-3 index indicate their potential to suffer sudden cardiac death, even when they may already have symptoms of coronary artery disease?
Well, the good thing and the bad thing about sudden cardiac death is that most people die from sudden cardiac death without knowing that they are prone to it. So the incidence of sudden cardiac death is quite low, but the absolute amount of sudden cardiac deaths that is being died from is fairly large in the general population. That is, people just don't wake up from their sleep, just die at the wheel, you name it. You've read all these stories in your paper, and that's what happens every day. As a matter of fact, about 15% of all deaths are sudden cardiac deaths.
And their first heart attack is obviously their last.
Well, that's definitely the case in about 60% of all heart attacks. People never reach the hospital.
And congestive heart failure is a longer-term disease that affects older people?
Congestive heart failure is a chronic condition, has a quite high mortality. People die from it at the same rate that they die from prostatic cancer. Cardiologists can treat congestive heart failure fairly well, but they'd like to treat it better. And a recent study has indicated that omega-3 fatty acids should be an integral part of the treatment of congestive heart failure.
And the average omega-3 index in people in Japan, you were saying, how does that compare again with Western nations?
Well, in Japan the average is around 10, whereas in Western nations it hovers slightly above 4. And there's a steep relation between risk of sudden cardiac death and the omega-3 index, which means that an omega-3 index of around 10 comes with an incidence of sudden cardiac death which is about 8, whereas the incidence of sudden cardiac death in a Western country is 20-fold that high.
And why do you think it is that the omega-3 index in the Japanese typically is higher than in individuals in Western nations?
Well, the traditional diet in Japan is fundamentally different from the typical diet in Western countries in that the Japanese eat much more fish. It's been shown fairly well that Japanese that live in Japan have a fundamentally different diet as the ones who live in the United States, and the ones who live in Hawaii are somewhere in between. And that same thing can be said for their cardiovascular diseases.
So that shows that it's nothing about the Japanese makeup, it's more the food that they're eating in those 3 environments that affects their...
It's not the Japanese genes, it's the Japanese diet.